Joining us on the blend this morning, we have Dr. Clint Simpson, who is a cataract and refractive specialist with Specialty Eye Institute. Doctor, thanks so much for joining us. I want to talk about LASIK this morning. Can you tell us a little bit about the procedure and maybe who can use the procedure to better their vision?
Sure. Thanks for having me on today, Bob. LASIK is a surgical modification of your cornea where we're using laser to change the shape of your eye and thus the prescription of your eye. It takes us about 10 minutes to perform on each eye, and the recovery is usually really quick. Most patients are seeing excellent in less than 1 week. LASIK is one of the safest and most accurate surgeries that we perform in the United States each year, and we perform personally hundreds of these surgeries each year.
So is it just taking a laser and kind of making a little flap or something in the eye?
That's right. We perform what's called all laser LASIK at Specialty Eye Institute. We use one laser to create a flap of tissue on the corneal surface, and then we use a second, what's called an ablative laser, which removes tissue from the cornea, and that's really what kind of reshapes the eye and changes the patient's prescription.
Interesting. Now, who is eligible or a candidate for LASIK?
Well, really, any adult between the ages of 20 years old and 50 years old with a stable glasses prescription, and that's someone who's just like really fed up with their glasses or contact lenses. They're usually a great candidate, but there are some special measurements and personal questions that we'll take, or history questions in the office that are required to kind of confirm their complete eligibility.
Doctor, what about those people who, aren't candidates for LASIK? Is there anything that they can take advantage of?
You betcha. So Specialty Eye offers a lot of different alternatives for patients, including something called PRK, which is a similar procedure to LASIK, but for those with a lot thinner corneas. We also offer a surgically implantable contact lenses, and we can also perform something called a refractive lens exchange. That's basically like having cataract surgery, but you don't have what's considered a significant cataract according to insurance.
I understand you have some specials going on right now, especially for first responders and for teachers, correct?
Yes, that's right, we do. Currently, Specialty Eye Institute is offering a $500 discount towards LASIK or PRK for first responders and teachers.
How can people best get in touch with you?
Oh, sure. The best place to get in touch with us is either by telephone, which will be showing up on the screen for folks at home, or you can visit our website and set up a free LASIK screening with one of our offices in the mid-Michigan area to help determine your complete eligibility.
And we'll put all that information on the screen. Doctor, thanks so much for taking time out this morning.
Hey, great. Thanks for having me on again. I appreciate it.